Hello everyone, and welcome to our video on part 2 of dangerous EKG rhythms. In this video, we'll be discussing 5 more dangerous EKG rhythms that every healthcare provider should be able to recognize and understand. We did a first video on potentially dangerous rhythms, and this is part 2. EKG rhythms can be very useful in diagnosing cardiac problems, but they can also be very dangerous if not identified and treated promptly. So, let's dive right in. Atrial fibrillation. Atrial fibrillation is a type of irregular heart rhythm, also known as arrhythmia, that occurs when the upper chambers of the heart, the atria, quiver or fibrillate instead of beating normally. This can cause the heart to beat too fast or too slow, leading to a range of symptoms such as palpitations, shortness of breath, chest pain, and fatigue. Atrial fibrillation can be potentially dangerous. It increases the risk of blood clots forming in the atria, which can then travel to the brain and cause a stroke. This is true if the ventricular rate is more than 100 beats per minute, which is called uncontrolled atrial fibrillation or rapid ventricular response. In fact, atrial fibrillation is a major risk factor for stroke, and people with this condition are 5 times more likely to have a stroke than those without it. Therefore, atrial fibrillation is considered a potentially dangerous rhythm that requires prompt diagnosis and treatment to manage the symptoms and reduce the risk of complications. Agonal rhythm. An agonal rhythm is an abnormal heart rhythm that occurs in the moments just before cardiac arrest. It is typically characterized by a slow and irregular pattern of electrical activity in the heart, often with wide QRS complexes and a slow heart rate. This is a very slow idioventricular rhythm with a heart rate of less than 20 beats per minute. The term agonal refers to the fact that this rhythm is often seen in people who are in the process of dying or who have suffered a sudden cardiac arrest. It is sometimes referred to as a death rattle rhythm, as it is often associated with gasping or labored breathing. Because agonal rhythms are usually indicative of a very serious medical condition, they require immediate attention and treatment. In many cases, cardiac arrest can be prevented or reversed if prompt medical intervention is taken. Pulseless electrical activity. Pulseless electrical activity, PA, is a medical condition in which the heart's electrical activity is present, but the heart is not effectively pumping blood. In PA, the heart's electrical activity can be detected through an EKG, but there is no palpable pulse or blood pressure. PA is usually caused by underlying conditions that prevent the heart from effectively contracting and pumping blood, such as severe heart disease, electrolyte imbalances, hypoxia, or drug overdose. Supraventricular tachycardia. Supraventricular tachycardia is a type of abnormal heart rhythm that originates from above the ventricles. It typically results in a rapid and regular heartbeat, with a rate greater than 100 beats per minute. While SVT is not always dangerous, it can be potentially life-threatening in some cases, especially if it persists for a prolonged period or if it occurs in patients with underlying heart disease. Second-degree AV block type 2. Second-degree AV block type 2, also known as Mobitz type 2, is a potentially dangerous heart rhythm where the electrical signals are completely blocked from the upper chambers, atria, to the lower chambers, ventricles, of the heart. Some electrical signals from the atria fail to reach the ventricles, causing skipped beats or dropped beats. This can lead to a slow heart rate and a decrease in the amount of blood pumped out of the heart. The danger of second-degree AV block type 2 is that it can progress rapidly to a complete heart block, which can cause sudden cardiac arrest and even death.
Thanks for watching. Subscribe and hit the like button so you can get the latest EKG analysis videos.